Hi everyone, welcome to another lecture on Billion Lab. Today's topic is the carcinoma of the male breast. In this picture, you can see this is the right breast and here the left breast, and in the left breast here we can see nipple and areolar complex. They are slightly disoriented and distorted relating to the right breast, and it diagnosed as a carcinoma of the male breast. So here we can see this figure. This is the carcinoma of the male breast. So let's see the details about the carcinoma of the male breast. Carcinoma of the male breast is less than 0.5%, so it is very less relating to the female, because in case of female it present 1 in 9 women in developed countries, but and in poorer countries it is 1 in 28 in case of poorer countries. So in case of higher socioeconomic countries it is about 11%, and in case of the poor countries it is more than 3%. But in case of the male breast it is very less, which is less than 0.5%. And the most common symptom is painless subareolar lump. So any breast cancer usually present with the breast lump, and in case of male the breast lump present just below the areolar region. So just subareolar region there is a lump, which is a significant uh, for carcinoma of the male breast. And in case of carcinoma of the male breast, the involvement of nipple areolar complex and underlying pectoral muscle occurs early. So this point is very important. In case of female, the pectoralis muscle or pectoral muscle involvement is late, but in case of male breast, as the breast directly lies on the pectoralis muscle, so the involvement of pectoralis muscle is very early. So involvement nipple areolar complex or NSC and underlying pectoral muscle. And here we can see this picture, that means the carcinoma of the breast. Here we can see the nipple and areolar area. This is distorted or change in shape, and it is the carcinoma of the breast. And the treatment comprises the treatment comprises mastectomy with 2 cm margin along with portion of underlying pectoralis major muscle, followed by radiotherapy. So this point is very important, that the carcinoma of the male breast, its treatment involves three important parts. One is the mastectomy with 2 cm margin, then cut of the pectoralis major muscle, that means part of the pectoralis major muscle, and then radiotherapy. So this point, the treatment of the carcinoma of the male breast, first of all mastectomy, then excision of the pectoralis major or part of the pectoralis major, and then radiotherapy. So these three important components for the treatment of the carcinoma of the male breast. Then here, sentinel lymph node biopsy should be performed in node negative patient. So if we don't find any lymph node in the axillary area, then we have to go for sentinel lymph node biopsy. And what is the sentinel lymph node? Sentinel lymph node is the first lymph node drains from this organ. And here we can see, in case of ER positive, that means estrogen receptor positive tumor, the patient should give tamoxifen 20 milligram daily for 5 years. So here you can see some other picture regarding the carcinoma of the male breast. So here we can see the nipple areolar complex are completely distorted and a mass appeared. In this picture also, here we can see this is the left nipple of 85 years old man with pedunculated and erythematous mass and associated nipple areolar enlargement. So it is all about the male breast, though it is a short topics, but it's very important regarding male, because the tumor of the male breast typically malignant, though it is incident is very low, that means less than 0.5%, but it is very significant that mass in the male breast typically it is cancer. Thank you all.